We would like to welcome you all on Independent Research Ethics Society's AYUSH Samriddhi International Conference Series at the milestone of 2055. Today, due to inspiration of Kamini Dhimanji, we have started this series on women wellness, as well as on every Thursday, we are conducting webinar on our infertility. So, Kamini ji will join very soon. I would like to welcome Dr. Divya, MD. Welcome, Dr. Divya, Assistant Professor, Department of Prasuti Tantra and Stri Rog, Government Ayurvedic College, 3, Punithura, if I have not spelled wrong. So thank you very much for joining. I would like to welcome Professor V. Agnihotri sir, Professor Rambir Sharma ji, and all the experts on the dais. Thank you very much for joining. I would like to request Professor V.K. Agnihotri sir for his preamble.
Thank you, Professor Pankaj Sharma ji. And I welcome all the guest speakers and the participants who have joined our platform of this IRES on the webinar numbering 2055 on the topic Sutika ParicharyA, as is been designed by Professor Kamini Diwan ma'am and her guidance. So I welcome all the guest speakers along with our all the participants and those who have joined the platform, and also those who are viewing our YouTube. I also request all the participants and those who are wishing to join, please join with their name so that we will be having their identity. This is a very important, simple protocol to join with your name. Well, as the subject is input, Sutika Paricharya, it's a very, very important from Gyani point of Gyani and Off's point of view, and also point of view of every lady itself. A person, a small child, a female child, she grows to the level of 18 to 21 years and gets married, and then it starts the family way, and then one gets pregnant. And after delivery, it is more and more important, especially the 40 days, that is the normal prenatal time. And also what are to be taken, what are to be consumed, what are goods and bads, and how the sub-involution of the uterus takes place, and with the presence of the Shulkala and on and on. So our guest speaker is intelligent enough to inform all these information to this platform, and also it will be in air by all the technical media. So I welcome our guest speaker of today, Dr. Divya. She hails from, she is assistant professor and coming from the Prasuti Tantra Institute department. So I welcome, and I think most of the persons have joined. So without delay, we will be liking to hear from you good information. We do hope that it will be a very informative session. And with these words, I also request Professor Pankaj Sharma ji to kindly invite. And Professor Kamini Diwan has told that she will be coming shortly, and she has assigned some competent person to coordinate to Dr. Divya. So over to Professor Pankaj Sharma ji. Namaskar.
Who is she?
Sir,
She is
namaste.
Vijaya. I think
Sir,
she is
I'm
Vijaya.
Dr. Vijla.
She is Vijaya, yes.
Hello, please, Darshan Devi.
Vigila.
Darshan Devi, coordinator.
Yes, sir.
Yeah. She has just...
Swagatam. She is coordinator on behalf of Kamini ji today.
Yeah.
Welcome.
Namaste. Myself, Dr. Vijla. I'm currently doing PhD in All India Institute of Ayurveda under Dr. Kamini Dhiman ma'am. Due to some busy schedule of Dr. Kamini ma'am, I will be stepping to introduce our guest speaker, Dr. Divya. Dr. Divya has done her post-graduation in Prasuti Tantra and Stri Roga from All India Institute of Ayurveda, New Delhi. And she is pursuing her PhD from Institute of Teaching and Research in Ayurveda, Jamnagar. and she is currently working as assistant professor in Prasudi Tantra and Stri Roga in Government Ayurveda College, Tripunitura from Kerala. And Divya will be covering her valuable insights on the topic Sutika Paricharya. And welcome, Dr. Divya, and looking forward to your presentation.
Thank you, Dr. Vijala ma'am. Shall I start? I think my presentation is already visible, right?
No, it was visible, but please share it again.
Okay, sir. Okay. Now it is visible, I think.
Yes, now it's visible. Yeah.
Are slides moving, sir?
Yeah, now it's a size form, of course, the size.
Okay, thank you, sir. So, first of all, I would like to thank Dr. Vijala ma'am for such a kind introduction. And I would like to extend my gratitude towards Dr. Kamini Dhiman ma'am for giving me this opportunity to present some views on Sutika Paricharya. And also, I would like to extend my gratitude towards Dr. Pawan Sharma sir, Professor Vineet Agnihotri sir, and Professor Vishnu Sharma sir for the support and for conducting such a great seminar series, international webinar series. Most of the practitioners, lecturers, and scholars are getting very much information from this international webinar series. So, first of all, thank you for sir. So I'm going to my session today. So our topic is Sutika Paricharya, a scientific approach. So the topic is not that much novel to all of us because I'm presenting this session in front of a scientific community. Most of us are practicing Sutika Paricharya in our day-to-day professional life very efficiently. And one of the main feature of this topic, Sutika Paricharya, is that which is having very much differences in terms of practices, concepts, and siddhanta across different regions of India. And it's an area where we can excel with our Ayurveda medications, and the common people also know about the same. So they are always willing to approach Ayurveda medical system to take Sutika Paricharya or Paricharya during the postnatal period, and they have very much believe in that also. So we have many more. We have really very good opportunity to excel in terms of Chikitsa and Siddhanta in the area of Sutika Paricharya. So it is not a novel area, but this session wouldn't be a one-way session, and it would be great if everyone can actively participate and contribute their knowledge also to this session. So today we will be dealing the session in terms of Sutika Kala, Ayurvedic review, and Puerperium, normal and abnormal conditions, and explanation of Sutika Paricharya in terms of Aushadha, Ahara, Vihara, external therapies, exercises, yoga and pranayama, and also breastfeeding and psychological factors during the Sutika Kala. I believe my voice is clear, no, sir? Okay, thank you, sir. So we know there is a famous quotation which is like Srihi Moolam Abatyanam Srihi Rakshadi Rakshida. So it is considered that the Sri is the Moola or the base of creation, and she is also considered as the base for propagation of family lineage. So it is said that such a kind of person should be protected, and even though she is the protector of all of us, we should protect her. So it is our duty to take care of postnatal women during their specific period where she faces many problems both mentally and physically. The famous saint Swami Vivekananda has said that ideal womanhood of India is motherhood. Nothing but the womanhood is considered as motherhood, especially in India, because how we see our mother. We see our mother like she's a marvelous person, unselfish, all-suffering, ever-forgiving mother. So that special care from our mind or heart should be given to her. As we are from medical professional or medical care system, we should extend our hands towards such areas for providing good health. So what is Sudika Upachara? Both the words Sudika and Upachara are not novel to us. Both Sudika and Upachara are different words, and Sudika Upachara is nothing but the care given to a woman after delivery. More than the word treatment, it would be great if we can use the word care instead of treatment. That is, Sudika ParicharyA is the care given to woman after delivery. So when we discuss about Sudika Kala, or we check the references regarding Sudika Kala across different samhitas or across the opinions of different Acharya, we can see many differences there. Like some of the Acharyas have not mentioned any particular period. At the same, some Acharyas have mentioned a period up to a long duration of 6 months. Like Charaka Samhita has not mentioned any particular period for the same. At the same time, Kashyapa has mentioned a minimum period of 1 month up to a maximum period of 6 months. Where Acharyas like Susruta and Vagbhada, they have mentioned that a duration of 45 days or till reappearance of menstruation can be considered as Sudika Kala. But at the same time, Bhava Prakasha and Yogaratna have quoted some different opinions, like menstruation, reappearance of menstruation is already there, but the duration of 4 months is quoted by Bhava Prakasha and Yogaratna. So what is the importance of these periods? Does it matter? Or why it is so different? Why in some samhitas there is no references regarding particular Sudika Kala? At the same time, in some samhitas it has been mentioned that up to a long period of 6 months. What can be the logic? What can be the reason here? So when we think about the Sudika Kala, the minimum period can be considered as 1 month according to Kashyapa. At the same time, a 45 days duration, which is 1.5 month or 1.5 month, we can say 1.5 month is mentioned by many acharyas. So when should we consider that period? That 1 month or 1.5 month, which may be considered in cases of normal delivery. We know in the modern text, for normal delivery, it is mentioned the word eutosia, and there are some specific checkpoints to determine whether it is a normal delivery or abnormal delivery. And if all the checkpoints are valid, or she followed all the checkpoints, if it is a eutosia or normal delivery, then we can follow the time period of 1.5 month or 1 month. At the same time, if the duration is 4 months or 6 months, how we can select the duration of 4 months or 6 months for Sudika Kala? In cases of Dukha Prasava Avastha, like LSCS, cesarean section, or instrumental vaginal delivery, such cases, we can go for a duration of 4 months or up to 6 months. Also, there can consider some other factors such as the Patya Sevana for Sudika in terms of Ahara and Vihara. That also can be extended up to a period of 4 months or 6 months. Why? 6 months is considered as the minimum period of to obtain the Purva Avastha of dosha or dhatu. Sadhmi Avastha is considered 6 months. So 6 months can be considered in that terms also. And the reappearance of menstruation, in all the other parts, it is mentioned in terms of days or month, but there is a physiological indicator which is nothing but the reappearance of menstruation. So it is a physiological indicator of what? It is an indicator that suggests he has or she has achieved her physiological status, or something that healthy status which is similar to that of the pre-pregnant state, that we can say here. So what is the importance of Sudika Kala, Sudika ParicharyA? Why it is important? There are two main contexts where we can divide all the factors, or all the dosha avastha, dhatu avastha, all the things in the particular period of Sudika avastha into two contexts, which is Shidila Sarva Dhadatvad and Shunya Shariratvad. In Sudika, we know all the dhatus, not a single dhatu, all the dhatus are in the Shidila avastha. And there is Shunya Sharira avastha due to expulsion of the product of conception like placenta, fetus, amniotic fluid, etc. So a mild derangement can cause life-threatening complication to the mother and baby. That's why extreme care should be taken during pregnancy as well as puerperial period. So what is this? In the context of Sutika, we know what is this. This is nothing but the Shunyagara. Shunyagara is considered as a empty house, unfurnished house or an empty house. So this is nothing but the health status of a Sutika, where there is only a framework is there and we have to build the tissues, dosha, samadhadu avastha, samadosha avastha, samakni avastha in the Sutika by Sutika ParicharyA to bring back her normal healthy status. When we call someone as a healthy one, we know there is Swastha Purusha Lakshana, in which Samadosha, Samakni, Samadhadu, Sama, Malakriya is mentioned there, and also mental factors like Prasanna Armendriya Mana is also mentioned. So physical as well as mental health is very much important. So what is happening in Sutika? There is no Samadosha Avastha. Why? Because there is Vada Pragopa. According to some Acharya, there is Tridosha Pragopa. Also, what is the status of Dadu, which we have already seen, which is in Shidilavastha. What is the chest of Agni? Agni is in Agni Kshayavastha. And Manasiga Bhava is also in she is in Avara Sotavastha during the particular postnatal period due to the Prasava Klesha. So we know the important factors by Garbha Vriddhi for the nourishing of the development fetus. Shidila Sarva, Sharira Dadu Avastha. Due to Pravahana Vedana and Kleda Rekta Nisrudi, Sutika is in a Avarabala stage. So we know in the context of Sutika ParicharyA, both in the basic part as well as in the Chikilsa part of Sutika, the dosha avastha is mentioned there, but the avastha of dhatu is very much considered as important there from the part of Masanumasiga Garbha Vriddhi. Why it is considered as important? Dhatu avastha. In many slogas it is mentioned that we should consider the avastha of dhatu in a Sutika prior to go for Chikilsa or ParicharyA in Sutika. Why? When we consider the Garbha Vriddhi, we can see that in the first month the Garbha is in Sarvadadu Kalishikrita Avastha. It is the Dhadus are not specifically formed, or we can't differentiate each Dhadu from one another. But what happens in successive months? In successive months, a specific Dhadu is developing. In some months, Mamsha Shonida Ubijay is happening. At some Rasadadu have importance at some month. So there is this difference. So what we can see or say, there is Upachaya of Garbha and Abhajaya of Garbhini here. So Dhatu Pushti is very much essential, or attaining the Dhatu Satmyata is very much important to return back to a normal healthy status in a Sudika. So before going to Chikilsa part of Sudika ParicharyA or Ayurvedic aspect, it would be great if we can go for some modern aspects also, because it is not necessary to discuss those things in very depth. But when we approach a patient, Sudika, in our daily practices, some of the things are very important. Some of the warning signs are important. Some of the basic physiological changes are very much important. So that should be covered, I think. So what is puerperium? That everyone knows. That definition is very familiar to everybody, which is period following childbirth, during which the body tissues, especially the pelvic organs, revert back approximately to the pre-pregnant state, both anatomically and physiologically, called as puerperium. Anatomical and physiological normal state is very much important. What is the duration? We know it is mentioned as 6 months, and we can divide it into three different stages, like immediate, early, and remote. Immediate within 24 hours, early up to 7 days, and remote up to 6 weeks, which is very familiar to everybody. So when we discuss about postnatal care, first thing is to be discussed is that how we should examine a Sudika. So examination part is containing many aspects, even though we are trying to conclude that into 3 sections, which is routine examination, pelvic examination, and laboratory investigation. In routine examination, what we can say, all vitals should be regularly checked. If you have a Sudika patient, we know tachycardia, hypertension, etc. are having its own clinical importance when it's come to postnatal period. So all vitals should be very carefully watched. And weight, what is the difference in weight? We know during the pregnancy period, approximately 11 to 12 kg weight gain is there. And after delivery, what is happening? There is weight loss. But what weight loss is there? There is loss of the weight of the baby, placenta, amniotic fluid, etc. But the increased intravascular volume is not coming back to its normal state as soon as the delivery is happening. It took some time. So that weight loss should be assessed there. Pallor, which is very much important because during the process of delivery, lot of blood loss is there. So that should be checked. Then one important thing is the involution of the uterus based on position of the fundus. So we should assess where is the position of fundus from which we can assess the rate of involution, whether it is normal or not. Then examination of the breast is very much important because for breastfeeding, a healthy breast is important. So if there is any nipple crack or any such kind of things there that can intervene with the normal breastfeeding process, so that should be examined, and if any problem is there, that should be addressed. Then what is lochia? Lochia we know, which is the discharge, vaginal discharge after delivery, and we know there are 3 stages, 3 different kinds of lochia are there, and we have to identify at which day or which phase of lochia the patient is approaching us, and we have to assess whether it is the discharge which is happening is normal, abnormal in terms of color, quantity, etc. Then we should assess the wound. Wound, which means there can be episiotomy wound or LSCS wound. So both of these should be addressed. Address, which means we should assess, examine detailing if the wound healing is properly happening, or any infection is there, any scarring is there, which is very much important to check. When it comes to pelvic examination, usually cervical cytology is performed, but if it is necessary only, then you should go for that. Otherwise, pelvic examination is not required. But in some postpartum period, they prefer to insert intrauterine cooperative devices. In such cases, you have to perform pelvic examination. Then laboratory investigation. I have only mentioned 2 laboratory investigation here, which is CBC and urine RM. It is not that we have to only perform these 2, but these 2 investigations are very much mandatory when it's come to a postnatal woman, to assess the level of hematocrit values, hemogram, and to assess infection, all those things. These 2 investigations are very much required. So this should not be omitted. So here in the picture, you can see the physician is assessing the involution process. So immediately following the delivery, we know the fundus should be at the level of umbilicus. So in the first picture, you can see the fundus is at the level of umbilicus, which indicates it is a period where it is immediately following the delivery. And the second picture, we can see there is the fundus is approximately 2 finger breadth below the umbilicus. So it could be 2 days postpartum. So according to the postpartum day, we have to assess the height of the fundus and whether the proper involution process is happening or not. So then I think we should discuss about some of the warning signs in the postnatal period. First one is puerperal pyrexia, nothing but the fever. But in the first 24 hours following the delivery, temperature raise can occur, which is very normal. But if you experience a temperature level of 100 degree Fahrenheit or 38 degrees Celsius at 2 or more than 2 different occasions, then it should be considered as puerperal pyrexia. And when come to the sepsis, that is infection during the postnatal period. What are the features? Features include fever, tachycardia, subinvoluted and tender uterus, foul-smelling lochia, unhealthy episiotomy, or LSCS wound. That should be checked. If there is infection in the episiotomy or LSCS wound, then that can cause sepsis. Or if there is foul-smelling lochia, which means there is endometritis. And if there is subinvolution of the uterus, which means there is some collection in the uterus. So all these things can lead to infection. So that should be checked with utmost care. When it's come to postpartum hemorrhage, we know PPH is a condition, especially in India, where took lives of many women. So, but nowadays our healthcare system has been advanced so that such cases are decreasing. Still, we have to check for the same. When it's come to postpartum hemorrhage PPS, we know there are two types, primary and secondary. Primary is the one which is occurring within the first 24 hours, and the secondary is after that up to 2 weeks. In such conditions, we know if there is primary PPH, the patient will be in the hospital. That will be managed immediately, and the risks are not that much there. But in cases of secondary hemorrhage, what is happening? The most most crucial time period is between 10 to 14 days, where secondary PPH can occur. So, if a postnatal woman is coming to you to your OPD at around this period, 10 to 14 days, and she is complaining about hemorrhage, that is uncontrolled excessive vaginal bleeding, then you have to think about this also in your mind. So what is sub-involution of the uterus? We know if the period-wise involution is not happening, then what may be the reason? We should assess each and every point one by one. And if immediately following delivery, we know the fundus is at the level of umbilicus, and there will be a decrease in the fundal height by approximately 1.25 centimeter per day following the delivery. So if the patient is coming to you on the third day of postpartum period, then you have to assess what will be the fundal height at that particular time, and then assess whether it is more than that or less than that. If it is more than that, what may be the reason? There will be there can be some collections. It could be a hematometra or retained product of conception. That can be the reason. And if it is less than that, what may be the reason? You have to assess, and proper care should be taken. Then some main complaints regarding breast engorgement, acute mastitis, breast abscess. Such cases can also approach you in the OPD. So in case of breast engorgement, compared to mastitis and breast abscess, engorgement is less complicated. And what will be the features? Features will be like pain in breast, feeling of heaviness or tenseness in breast, and there will be transient rise in temperature and painful breastfeeding. In such cases, you have to diagnose it as breast engorgement, then care should be given accordingly. And when it changes to acute mastitis stage, then there will be fever with chills. And also, usually mastitis is unilateral, so there will be pain and swelling in one quadrant of the breast, and the overlying skin will be warm and flushed. That should be noted. In such cases, you have to diagnose it as acute mastitis, and care should be taken accordingly. And when it changes to abscess stage, all the above clinical features will be there, but also there will be marked tenderness and fluctuation. And we know postnatal period is during the process of delivery, the woman is facing so much trauma. Labor is literally a traumatic process. So following delivery, they can experience different psychological problems. In the previous era, no one was giving that much importance to the psychological disturbances in a postnatal one, but now it is not like that. Almost all the family members, friends, everybody is aware about the postnatal psychological problems that can occur in a woman. So utmost care is giving. Still, we have to check all these things in the postnatal woman, if it is there or not. If any of this one has been diagnosed, then proper care should be given. And the comparatively less severe condition is puerperal blues, which means the patient may experience depression, anxiety, insomnia, and negative feelings, and it is usually occurring after 4 to 5 days following delivery and lasting for only few days. Usually, counseling only can help the patient in overcoming such situation. When it's come to postpartum depression, what is happening? There will be insomnia, irritability, social withdrawal. Most importantly, there will be suicidal tendency, and the onset is very much important, that it will be of a more gradual onset over a period of 4 to 6 months. So in such cases, medication should be given. And the most serious condition is that postpartum psychosis or schizophrenia. In such conditions, patient can experience fear, restlessness, confusion, hallucination, and most importantly, suicidal and infanticidal tendencies are occurring in this postpartum psychosis or schizophrenia. So in such cases, utmost care should be there. Then what should be the advices that we should provide to the mother? And there can be many doubts from the part of mother, family of the mother. So we have to address all of those things, but it won't be possible to discuss all the things in this class. But some of the things are like when we should start ambulation, what should be the diet, bladder care, care of the bowel, episiotomy wound care, asepsis and antibiotics management, care of the breast, breastfeeding, and care of the neonates, immunization schedules, postnatal exercises, contraception advices, psychological counseling, drugs, and postnatal checkup. All of these things will be asked by the patient. So you have to counsel them correctly. That is also a part of postnatal care. So we all know what is rooming in, we know what is exclusive breastfeeding, we know when to start breastfeeding. So in normal labor, breastfeeding should start as soon as possible. In cases of LSES, we can start breastfeeding after regaining the consciousness of the patient or within 2 to 3 hours. In cases of inadequate lactation, we can provide other top feed formulas like lactogen, etc. And then what should be the frequency? Initially 2 to 3 hours or interval should be there for feeding, or on demand can give. So and care should be taken to clean and kept dry the nipples. So breastfeeding techniques, there are different techniques for breastfeeding. Any of one can follow. These are the position that usually a postnatal woman can take or follow for feeding the baby. Latching or attachment, which is very much important when it comes to breastfeeding. How it should be, the proper step is like the baby's cheek should be touched to breast so that rooting reflex will be elicited. Then open mouth widely so that it will be properly latched onto the breast. The nipple and areola should be inside the mouth of baby, then only proper suckling will be there. Then postpartum contraception, usually what we say breastfeeding is sometimes adequate for contraception, but is that so? So what we can say, exclusive breastfeeding can provide protection up to 6 months in 98% cases, but chances of failure is there. So in case of non-lactating woman, what we can give combined oral contraceptive methods or barrier methods or IUCDs, postpartum IUCDs can be provided. In case of lactating woman, progestin only pills, progestins, implants, IUCDs, permanent methods and barrier methods can be provided. But informed consent is mandatory and proper counseling is mandatory. So this is only about the modern aspect that I don't think we need to go into deep such topics. Our today's main topic is Sutika ParicharyA as per Ayurveda. So as per Ayurveda, what is our aim when it's come to taking care of Prasuda Stree? So our aims include to restore the health status of the mother and to bring back the Garbhashya and Yoni to the normal status. Also, the aim include prevention of infection and to restore the Dadubala stage and to relieve body pain, weakness, and to enhance the production of milk and to for toning up the muscle. All things are coming under the Sutika ParicharyA. So when we prepare a particular care to a particular Sutika woman, Prakriti should be assessed, her condition should be assessed, what is her need, that should be assessed. Even if it is multi-para or primary-para, that should be considered according to the parity. The care that we should give for that particular lady is different. So all these things should be come into our mind when we fix the Sutika ParicharyA. So we know in Sutika Avastha what are the risk factors or what are the things that causes the Balakshina there. First one is Sharira Shunya Avastha. If there is Sharira Shunyada or Ashaya Shunyada, there will be Vata Pragoba that can lead to some other Anila Vyadhis. So that should be taken care of. And we have already discussed that there is Shidila Dadu and Dadukshaya Avastha. Also, there is Agni Mandya Avastha, and also due to Nisruti of Klayata and Rekta, there is Vada Pragoba and Balakshaya. Also, we should consider Sudiga as a Prani. So, Pranida Ubasaniya chapter should be read properly, and the principles of that chapter should follow here. And the Vada Pragoba Avastha is there in Sudika. We all know that even though it is Tridosha Avastha Pragoba, the main factor which leads to Vada Pragoba are Pravahana, Dadukshaya, and Ashariktada. So when we practice Sudika Paricharya, it is usually comprises in terms of Ahara, Aushada, and Vihara. First of all, come to Aushada. What are the principles of Sudika Paricharya? We know in general in Sudika Paricharya, Garbhashya Shodhana should be there, Agni Deepana should be there, Vedana Samana and Vrana Ropana Chikilsa, Vada Lopana, Bela Vritti and Stanya, Janana Chikilsa should be there. But the first line of management, immediately following the delivery, first line of management is in the line of Atyaiga Chikilsa, where we should follow Garbhashya Shodhana, Vedana Shamaka, Vedana Vrana Ropana, and Agni Sandoshana Chikilsa. And if we divide the Sudika Paricharya in different phases, consider we divide it into 3 phases like phase 1, phase 2, and phase 3. Phase 1 can consider as first day following delivery to 3, 5th, or 7th days. According to different patient, it can vary up to the 3 days, 5 days, or 7 days. In that particular period, what should we concentrate? We should concentrate on Agni Devana Chikilsa, that is Devana and Pachana, Garbhashya Shodhana, Vedana Sthapana, Vada Niyamana, and Vrana Ropana Chikilsa. At the same, in the second phase, which we can consider from the period that end up first phase and up to 12 or 14 days, where we should more focus on Sadharana Poshan and Dhatu Vriddhi. In the third phase, 14-day onwards, we can go for Brahmana and Punanavikarna Chikilsa. This is a general principle only, but according to patient, the condition can vary. Coming to the phase 1, that is from the first or 3, 5, 7 days, then what we can give there, the main focus is the Devana and Pachana, Chikilsa, Garbhashya Shodhana, Vrana Ropana, Vedana Savana, etc. So what all medications can be prescribed there? We can give Panchakola, maybe in term, maybe like Churna, Fanda, or Asava. Deepyagadi Churna can be given there, Trigadu Churna can be given, Chitragadi Badi can be given, or it is better to prescribe for 3 days and better to avoid for more than 3 days if you are prescribing Chitragadi Badi. Pulinkoyamba, which is a special formulation mainly found in Kerala, that can give Ardraga and honey can be given. All of these are Deepana Pachana as well as Garbhashya Shodhana. When it comes to perennial care or Vrana Ropana, but we can give Jatyadi Grita, or some practices are there by using Kumari, Kalka and Haridra, each in equal quantity of 3 gram. We can mix and we can prepare it like a paste and you can apply it over the prana in the episiotomy wound. Not an LSCS wound, episiotomy wound, you can apply this paste. And you can follow Dhupanam, that is fumigation, which is prepared with Agaru, Pushta, Guggulu, Haridra, which we can follow for a duration of 10 minutes every day for 7 days. And also Kshalana, Prakshalana, Yoni Prakshalana, Vrana Prakshalana, etc. are having good effects in Vrana Ropana. We can adopt Nalpamara Kashaya Kshalana or Tripla Kashaya Kshalana according to the condition and after assessing the dosha avastha of Prana. When it comes to next phase, which is up to 12 to 14 days, where we can go for Arishta preparations and Kashaya preparation. But it is very important to notice that it is not necessary that all the patients should be prescribed with Arishta, because Arishta is a little bit of Vatala and Pitta Pragopakara. So only after assessing the condition of the patient, you should go for Arishta or Kashaya, and both of this Kalpana is suitable for that particular patient, then you can go for both. And there are several permutation and combinations of Arishta, Asava, and Kashayas are available. Only quoting some of the possibilities here, which means usually most of the time what the combination which we are prescribing is Dashimola Arishta and Shiraga Arishta, which is very much beneficial in Garbhashya Shodhana and Stanyavardhaga things. And then if there is Agni Mandya, you can go for Panchakola Asava or Pipalya Asava. If there is anemia, you can use lohasa or Draksharishta individually, or mix of both can also be used. In case of bleeding, excessive bleeding, we can go for Ashokarishta. And if there is Jara or Amavasta, we can go for Mustarishta. And if the baby is having Jara also, then go for Mustarishta. And Belarishta, in case Belarishta is considered as Ugra Bada Shamana and Asti Marma Mamsa Belya. So in cases where Dukha Prasava Avastha is there, like instrumental vaginal delivery, such condition, we can go for Belarishta. Then there are some choices for Kashayas also. Usually we prescribe Arishtas first, then we go for Kashaya, and it is not necessary to prescribe both of the Kalpanas in a single patient. Sometimes you can go for a single Kalpana in a patient according to the Prakriti and condition of the patient. That should be left for the Pramana Yukti Parisha. Then if we are going for Kashaya, then there are some choices like Dhanvantara Kashaya, Maharasnadi Kashaya, Gandravastadi Kashaya, Dashamula Kashaya, Mustadi Marma Kashaya, and Vidaryadi Kashaya, and all of this should be prescribed accordingly or judicially. When it comes to phase 3, which is 14-day onwards, where we go for Brahmanan Puranavikarna Chikitsa, but only start this kind of treatment after assessing the Agni Bala of the patient and the necessity in that particular patient. There is some practices like we usually go for Dibana Pasana Chikitsa, then Arishtas and Kashayas are usually prescribing. Then patients are usually demanding Lehyas or rasayanas, because according to layman's knowledge, they are considering the rasayanas or lehya preparation as the best for Sutika or a postnatal wound. But we know that it is not necessary that we should prescribe lehya preparations or rasayana preparation to every patient. Only after assessing the patient's individual avastha, then we should go for this kind of chikitsa. And the important thing is that always check whether the patient has attained the Agni Deepti avastha or not. Before attaining the Agni Deepti avastha, don't prescribe or don't go for Brahmana or Rasayana chikitsa. And for Brahmana and Puranavikarna or Rasayana chikitsa, we may use Panchajira, Guda, Saubhagya Shundi, Kalyana Grida. If there is postpartum depression, then we can go for Kalyana Grida. And for the purpose of Vada Pitta Shamana, if the patient is having Vada Pitta Pragopa Avastha, then go for Vidaryadi Grida. And Amrta Pasha Grida if there is Dadukshaya. And we can also go for Chavana Prasha, Dadimadi Grida, Indukanda Grida, and Shugandhadi Lekhya, Jamamsa Rasayana, etc. And this Ulli Lekhya, Uluva Lekhya, Tenginpukula Rasayana, etc. specifically practiced in Kerala. And when it comes to Ahara, we know Patya Sevana in terms of Ahara and Vihara is very much important in the particular postnatal period. So, Ahara for the initial days should be Lekhu, it should be Dipana Pachana, and should be helpful in digesting the heavy food that usually people are prescribing following the first weeks of postnatal period. They usually begins to take non-veg foods, mamsa, etc. So in the initial phase following the delivery, to obtain proper Agni Deepti, we should go for Lekhu Subhaji Ahara. And for the first 3 days, we may go for Manda preparations or Yavagu preparation. This can be prepared with Panchakola, Lekhu Panchamula Kvada or Dashamula Kvada. Followed by that, we can go for Shira Yavagu, which is prepared with Vidaryadikana. And all the time, try to keep in mind that whenever we prepare food or whenever we advise patient to special kind of food preparations, to follow special kind of preparation, ask them to add this kind of spices in their food, like ashali, which is Chandrashura, Lashuna, Ajamoda, Medika, Jiraga, etc. can be added. Grinjanaga can be added. Shigravatra, that is moringa leaves, which is considered as Sanya Janana. This kind of spices and food articles can be incorporated in their Patya Ahara. And Mamsarasa preparations, which is one of the main food preparation that we are using, Mamsa Rasa preparation, usually in cases where Dukha Prasava Avastha is there, or the patient is experiencing severe low backache following delivery. Such cases we can give Mamsa Rasa. Usually To preparing Mamsarasa, Dhanvantara Kashaya Churna is used and goat's backbone and meat are used. After preparing the Mamsarasa, you can add prasheba like drugs like Dhaniga, Jiraga, Tuk, Jadifala, etc. And try to keep in mind that we can only go for Mamsa preparations or Mamsarasa, etc. from the 14th day only after attaining the Agni Balam. Then coming to the panas are also very much helpful in Garbhashaya Shodhana, Pranaropana, and Vedana Sthapana. So we can go for Gudodaga preparations or paniyas which are prepared with Dhanika, Pippali, Trigadu, and Trijada may be used. Also, Yusha preparations like Mudga Yusha and Kulata Yushas are also being practiced. When it comes to Vihara, it is very much important for a postnatal woman to follow some particular viharas for regaining her health, which include Sudika Snana, Udaraveshta, etc. So when it first we will be discussing about Sudika Snana. We know in our text part it is said that Sudika Utthana Karma or Sudika Snana is mentioned on the 10th to 12th day. But what we are saying here is the taking bath with medicated drugs for Sudika. So in that cases, what we can say, when to start during normal vaginal delivery, usually on the second day of vaginal delivery, they are prescribing or they are advising to take bath. In cases of cesarean section, the proper bath may be can start to take after discharge from the hospital. Before that, cleaning of the body with sponging or warm water sponging or such kind of things can be practiced, but the proper snana or Sudika snana, what we are saying here, is to be practiced after the discharge in case of cesarean section and from the second day onwards in case of normal vaginal delivery. We usually prepare some medicated water for Sudika snana, and before that, for oiling of the body or abhyanga, some medicated oils are also using. But it should be keep in mind that in case there is episiotomy wound or LSCS wound, better to avoid use of thyra preparation around the wound, because sometimes it won't be always possible to remove the debriments from the wound properly. If it is remaining there, some kind of infection maybe can happen there. So that should be keep in mind. So what all thyla can be applied here? Dhanvantara thyla is usually prescribed. Also according to the condition, Pinda thyla, Mahanarayana thyla, and Karpuradi thyla may be prescribed. What are the benefits? It helps in regain muscle power, also relieve the joint pain, and it also has an antiseptic action. So after Abhyanga, we can go for Snana. For Snana, what we are usually using, some medicated kind of water we are using, but the drugs which are selecting for preparing such kind of water, medicated water, is different according to different regions. But in general, if there is Vada Pragopavastha, Dashamula Snanodaka can be prepared. If there is Pitta Pragopavastha, Dalpamara can be prepared. And if there is Vada Kapha Pragopa, then Haritra Nimbakalpa Kalkape should be used there. And for Shira Snana, Ushira Amalagi may be used, but always keep in mind in Kapha Pradhana patient, Kapha Pragrati patient, or if there is Kapha vitiation, if we are going for too much Shida prepared drugs, then there will be sinusitis or some kind of complication could be there. So that should be taken care of. And there is some preparation, we usually call it as Veduvalla in Kerala, is nothing but the medicated water for Snana. And some locally available drugs are using of preparing such kind of water. And what we usually go for is that Nimba Patra, Nirkundi, etc. And we can use Haridra in such cases. And judicial preparation of the medicated water is required. And the benefits include Vadanilomana, Ropana, Agni, Dipti, and Dehashuddhi. And when it's come to Shiro Abhyanga, we usually prescribe is that whatever medicated oil that were used by the patient during the pre-pregnancy period, we advise them to continue the same. But if there is any particular condition, then we may ask them to change their oil or medicated oil that they are using for Shiro Abhyanga. And in some cases, if she is having a Kapha Prakriti patient or she is having PNSA or some kind of disturbances, then we can simply fry the Kurumulak and Karinjiragam. Jeeraga and Maricha in the coconut oil, and we can use that for Shiro Abhyanga. And based on specific conditions, like if the patient is experiencing postpartum depression, then we can go for Marichadi Taila or Triphala Taila. And if there is some aggravated behaviors like schizophrenia and all, then we can go for Shirabala Taila. And then comes to the Veshtana, and previously it was very much, Patra Veshtana was very much important, or they were following Patra Veshtana, but nowadays what? Some kind of lumbosacral belt, postpartum belly wrap are available. So nowadays people are changing to some kind of things, but before that, Patta Bandhana was usually performed. So what is Patta Bandhana? Patta Bandhana is nothing but the bandaging of abdomen using cotton cloth. Nowadays they are using abdominal belt, and we can use approximately 2 meter length belt, cotton, and width of 12 inches, and you can fold it into a proper manner, and then you can go for Patta Bandhana, and this should be wrapped on abdomen from the symphysis pubis to the lower costal margin. Tightness should be medium. And when should be performed Patta Bandhana? After 2 to 3 hours in case of full-term normal vaginal delivery, and after 5 days in cases of cesarean section. And after Sutika Snana, every day you may go for Patta Bandhana. And we know during Sutika Kala there is Shunya Sharira, and there will be Vata Prakopa. So the Patta Bandhana will help in uh, uh, defeating that condition. We know Vimardana, Bandhana, etc. are mentioned in the treatment of Vata Prakopa. So in that way also this will be helpful, and also this will help in supporting the pelvic girdle, and also will help in strengthening the abdominal muscles. So postnatal exercise and yogasanas. Nowadays, we know separate clinics are available for prescribing postnatal yogasanas and exercise. But from the initial state, what we can do, we can go for walking, simple stretching exercises can be performed. But in strenuous yogasana and such kind of exercise, we may wait to 1 month for normal delivery and for 3 months in cases of cesarean section, or analyze the patient condition and then only advise such kind of practices to the patient. These are simple kind of stretching exercises that can be easily followed in the postnatal period. And one more important thing is that Kegel's exercise that we usually advise for pelvic organ prolapse, but it is having good effect in postnatal period. If you are prescribing Kegel's exercise, which will help in strengthen the pelvic floor muscles. So Kegel's exercise can be also prescribed. So what are the advantages which we know, which will help in strengthen abdominal muscles and prevent genital prolapse and stress incontinence? When it's come to yogasana, different kind of asanas has been mentioned, but always take a proper advice from the yoga instructor, then only advise such kind of things. And what we can usually perform or advise to the patient is that Ardha Kadi Padahastasana, Vajrasana, Ardha Mansendrasana, Paschimottanasana, Pavana Muktasana, Sedubandhasana, Bhujangasana, Merudandasana, Ushtrasana, such kind of yogasana may be prescribed. Also pranayama, Nadi Shuddhi, Brahmari and Shidali pranayama may be prescribed. And now we comes to the management of ailments during Sutika Kala. So there could be many different conditions that you may face during your OPDs, but some of the common ailments we have to address, and some of them are we are discussing here, like Sanyakshaya. Sanyakshaya is a common complaint. So what we can advise there, first of all, we should advise the diet changes or dietary preparation should be advised. Then only we should go for medication. So milk and milk product can be prescribed. Leafy vegetables should be advised, and calcium-rich food should be advised to the patient, and ask them to add food particles like lashuna, jeeraga, shadavari, kulatan, medika in food. All of these things are considered as having lactogenic property. And then Shigrubatra fried in ghee can be advised to them. And Shadavari Shirakashaya is considered as very much effective in Sanyakshaya condition. When it's come to breast engorgement, it is a mild case, we know, in the initial state only. So at that time, what we can give, we can advise them for mild sedation as squeezing of the breast milk. These two things only may help in reducing the breast engorgement. But if this stages is passing or not giving proper care at this particular stage, then it can change into a mastitis or abscess. Then there should be further cares, there should be drainage and all. In cases of cracked nipples, which is very common presentations in our OPDs, external application can be given, internal medications may be given. In external application, Jatyadi Thaila can be advised to apply, or Mahadikta Grida may be advised to apply in the cracked areas of nipples, and they should always be asked to remove it before giving or feeding the baby. Then Gugulu Panchapala Churna internally may be prescribed. Then it's Vayu Kshoba, and there is bloating, abdominal disturbances, all things are very common during the postnatal period. So simply Jeeraka and tender coconut water can be advised to them. Simple diet changes should be advised to them. Advise them to add Jeeraka and other such kind of things, Deepana Bhajana, Badanalamana things in their food preparation. Then such kind of simple remedies can give relief to them. Otherwise, we may prescribe Mahadanvandana Guliga, Jeerakarishta, Abhayarishta, etc. But we always consider the status of the baby when we prescribe medicines to the postnatal woman. What is the condition of the baby, which is very much important. And when it comes to infection, peripheral infections or pyrexia, if there is local infection, consider there is wound infection or episiotomy wound infection, then externally you can go for Prakshalana using Alpamira Kashaya or Triphala Kashaya. Internally, you can go for Gugulu Panchabala Churna. And also some other Kashayas like Amurdotra, Bala Kudutivadi Kashaya, Gulujadi Kashayas are giving very good results in cases of vulvovaginal infections and peripheral pyrexia. Next is some special preparations that we are usually in the postnatal period. One is Moringa Lehya, which is Shigru Patra Lehya, what we can call, and in which the preparation is Guda Kalpana. The ingredients are leaves of Moringa or Shigru Patra, Jaggery, honey and ghee, and the Kalpana is Gudabaga Kalpana, which is considered as very much effective for Stanya Vardhana. And Uluva is considered as a single drug which have lactogenic property. So Uluva preparations are very much used across different parts of Kerala. Uluva is prepared in terms of lehya, and it is powdered as powdered with some other medication that is also given to the patient. So Uluva preparations are very much available across different parts of Kerala. The common one is Uluva Kanni. Uluva Kanni is nothing but the Kanni preparation where Uluva is also added to it, and coconut, grinded coconut or coconut milk can also be added. Such a kind of preparations or Kanni is called as Uluva Kanni, which is considered as Agni Deepana, Belya, and it helps in involution of the uterus also. And Stanya Vardhana, many of the patients are having this complaint of Stanya Kshaya or not enough production of breast milk. In such cases, you can go for prescribing Uluva Kanni, which is very useful in and very useful you can prescribe, and very good results are always seen in patients. So sometimes what we say, whenever we see a patient or we see some complaints in patient, we always go for prescribing medications. But in Sutika ParicharyA or postnatal care, it is very much important that first go for Patya Acharana. Then only we should go for medicinal prescription, because Sutika is in Avarabella stage and medications are having some virya, Mrudu virya Aushadas are there, Ugra virya Aushadas are there. So before prescribing particular medication to patient, always look for some Patya Ahara Vihara if that could be beneficial in that particular person or particular Sudika. If it is beneficial, manage then such cases with Patya Ahara Vihara only. Then if it is not manageable with that, then only go for medicines. So always advise the patient to go follow Patya Ahara Vihara for at least 45 days. Acne should be properly managed for this 2 to 3 months. Even though we are only giving Acne Dipana Pajana drugs during the first week or initial days of postpartum period, it is very much important to concentrate on managing the acne of the patient throughout the postnatal period at least 2 to 3 months. Then, according to the mode of delivery, whether it is normal vaginal delivery or it is assisted delivery or it is LSES, then management protocol will be different. That we have to address. We have to address the particular condition of the patient. Then only we go for particular medicinal options. So in general, if we consider first 3 days, we go for Depana Pachana, then we can go for Arishtan Kashaya preparation, then we can go for Rasayana Chikitsa. But it is very much important to keep in mind that it is not necessary to prescribe all these things in a serial order in all the patients. Address the patient's particular condition, then only go for prescribing medications. Thank you.
Nice, nice, Divya.
Namaste, ma'am.
Yeah, namaste. You have presented very nicely. Though I joined little late, 5-10 minutes late, but you have covered all in this your last preparation. That was kanji. Ulva kanji was new for me. I was not knowing about that. It is helpful in involution. Yeah, I have not heard previously. So session is open for questions. If anyone want to ask any question, you can put up the question, or anyone want to add something can add. Anybody want to ask questions about this specific session of Sutika Paricharya? She has covered all the topics, all the points that how we have to care delivered woman, what should be the diet and what she has to take and what should be the vihar and what should be the medications if needed. Not always medicine are given, but we can change the dietary habits of that woman or according to desh kal. It is mentioned in Ayurveda this desh kal और जाति उसके हिसाब से सब जगह अलग अलग जो है सुतिका परिचर्या की जाती है, बट लेकिन शास्त्रोक्त एंड स्पेसिफिक विद द साइंटिफिक view or scientific justification, she has explained everything. So we can take up the questions if anyone has. कोई कुछ ऐड करना चाहे तो बोल सकता है. अंजना मैडम भी लास्ट थोड़ा लेट जुड़ी हैं सबसे लास्ट में, तो उन्होंने सुना भी नहीं है, तो मैं क्या उनको भी बोलूंगी, है ना. We are having one new speaker, Dr. Manjusha Karkare. This time, she is interested in our webinar. So, Dr. Manjusha, if you want to add anything in that, Sutika Paricharya, you can. You are welcomed.
Congratulations for a very nice presentation, madam. Almost everything was covered, and these few recipes that are very peculiar to the south and kashayas also, that we are that was addition in our knowledge. So that was welcome thing. Only thing we are not aware of so many names of the kashayas. आपने बीच में mention किए, even the लास्ट क्षीरपाक या जो आपने यूश मेंशन किया, वो शायद कुलत्था का है क्या, फ्रॉम द अपीयरेंस?
Yes, ma'am.
ओके
Which
ओके.
one?
कुलत्था यूश
No,
नहीं,
ma'am.
लास्ट.
Which one you are saying?
कांजी. हाँ, यस यस.
Ma'am, this is Methika.
उल्लुवा मीन्स मेथिका.
Methika, ma'am. Yes, it is Methika.
Okay, because Kulathayusha has been mentioned in Kashyap.
Yes, ma'am.
Kulathayusham Prasniham Lavanamlas Tathaparam. So I thought by the appearance it is reddish, so I thought it
Yes,
is
ma'am.
made
It
from
is somewhat
Kulatha.
similar in look.
Similar looking, yes, yes. And other kashayas and all that you had mentioned, but so many of them drugs, they are in the, I think, the local language. So it was not
Kashaya.
kuch mm, कषायाज या द्रव्याज ऐसा कुछ तो भी था.
नहीं, ये सारे शास्त्रोक्त कषाय हैं सब.
शास्त्रोक्त कषाय है या
हाँ, सारे
कोई
शास्त्रोक्त है.
द्रव्य या आहार द्रव्यों के नाम थे क्या कहीं पे? मुझे ऐसा
इस
लगा कि ये नहीं समझ रहा है ऐसा कुछ नहीं है. ऑलमोस्ट यार दीज आर शास्त्रोक्त ये धानवंतर
हाँ,
महाराज ने दिए.
ये सारे
यस,
शास्त्रोक्त कषाय हैं.
करेक्ट करेक्ट.
हम्म.
एंड धूपन के बारे में आपने कुछ किया क्या मेंशन? योनि
Yes, ma'am.
धूपन.
Yes, ma'am. You need open during the postnatal period. We can go for usually, ma'am, we used to perform their Haridra Brahadi Dvaya Haridra Dopana.
हाँ हाँ
Or otherwise, we can go for Gugulu, etc. preparations.
हाँ या कुष्ठ गुगुल अगुरुभिर धूपयत घृत संयुत ये.
Yes, ma'am.
That is the classical reference and that importance of धूपन is very great in मतलब ये सूती का आगार का भी धूपन बताया है. सूती का के other antiseptic measures if you are not using, then also this has a germicidal activity, proven activity germicidal है इनकी. So they are सूती का आगार, सूती का के कपड़े, बच्चे के कपड़े, इवन ट्रेडिशन में भी ये बच्चे को भी धूप दिलाते हैं आफ्टर गिविंग द bath to the child. Then that helps to expel the excessive कफ दोष accumulated in the throat, chest and all that. तो बात के बाद इवन बच्चे को भी धुआं वो दिला देते हैं. The Dupana part, it is very widely practiced in Maharashtra, this area. How is it in your area? I'm not aware. But Dupana अच्छे तरीके से होता है. So nice presentation. And a lot of work also was done on Sutika and Parul. This ये हरितोक्त Sutika Paricharya दी थी. फिर there was one work under me in which we prepared a spray for the episiotomy wound healing. So without touching the wound, you could apply this runner opener spray kind of thing. So it has given good results in the comparison with the just betadine. The comparison showed that our spray, which was formulated based on herbal combination, it gave more pain relief to the episiotomy also, which active and healing activity was very good. But which almost मतलब comparable या better than कह सकते हैं to betadine. But the main thing was that the pain relief factor was there. So अब हमारे जो drugs में जो स्नेह का अंश रहता है उसमें उससे I guess it and other drugs they contribute to that reducing that pain in that discomfort in that area, which is a major problem for the Sutikas, and they are not able to sit and even feed and constant discomfort. तो वो relief अच्छा मिला है हमारे यहाँ तालीसादी मलहर के ऊपर भी काम हुआ है और एक स्प्रे के ऊपर भी काम हुआ है. So both these drugs they have given good results in
इसका मैडम
wound
इसका भी
healing
काम,
also.
इसने भी सुतिका परिचर्या पे ही काम किया है, पर ये है कि इसने
हाँ
अपना
हाँ
काम नहीं बताया. इसने जनरल पूरा ओवरऑल सारा
हाँ हाँ
टॉपिक कवर किया है. इसने भी
हाँ
सुतिका
हाँ हाँ ये
परिचर्या
मैं
पे
जस्ट
ही अपना.
एक्सपीरियंस ऐड
हाँ
कर रही थी कि
हाँ हाँ
ऐसा भी
हाँ.
काम हुआ है तो
नाइस
फिर
नाइस. इसने भी.
ये हमारे का बेनिफिट है कि हम बीटाडीन करते रहते हैं पर पेन रिलीफ जो फैक्टर है वो हमारी द्रव्यों से अच्छी तरीके से मिलता है. जस्ट हमारी ऑब्जर्वेशन की है स्टडीज के टाइम में. सो आई वाज
हाँ.
जस्ट सेइंग दैट.
दिव्या, दो
गुड
तीन
मैम.
क्वेश्चन है, देखना चैट बॉक्स में कुछ क्वेश्चंस भी हैं, वो ले लेना जरा दिव्या,
Okay.
है ना. हाँ, एक दो क्वेश्चन है, कुछ पूछे हैं, कुछ प्रिपरेशन समझना चाहते हैं और कुछ कि अगर हम ओरल देते हैं तो बच्चे पे इफेक्ट आता है क्या, ऐसा कुछ क्वेश्चन.
एक मैम उल्ली लेहम पर है, उल्ली लेहम एंड थेगमेंट पोकुला.
हाँ, बता देगी वो.
Fully lehi and thing in Pukulano, ma'am. Hello.
Yes, ma'am. This is mentioned in the chat
Okay.
box.
Okay. Ulli lehi, actually ulli, which means onion. Ulli is onion, nothing but onion, and the preparation is Gudapaga Kalpana. So the lehya prepared with small onions, no, that is called as ulli lehya, which is a special preparation usually used in Kerala.
उसको
That
कैसे
has
बनाते
got
हैं, थोड़ा सा 2 मिनट थोड़ा सा बता दो कि उसमें ऑनियन का क्या करते हैं, गुड़ का क्या करते हैं, और थोड़ा सा उनको एक्सप्लेन कर दो।
okay, ma'am. The preparation is Gudabaga Kalpana only, in which kalka is the fried paste of onions. And the prashava dravyas are usually what you use in Gudabaga Kalpana, that is ela, etc. is added. That is Chadurjada, Trigadu, and all those things are added as prashava dravya. And the kalka is nothing but the paste of ulli, that is onion, after
हाँ,
frying in ghee.
वो गर्भाशय शोधन है वो
Which
इसका
is
मतलब।
Garbhashya Shodhan and Stanyavardhana also.
हाँ, गर्भाशय शोधन, क्योंकि गुड़ है, चतुर जाते, वो सारा शोधन का काम करता है ना, तो गर्भाशय शोधन के लिए हुआ है ना।
Yes, ma'am.
हम्म हम्म
And Tengin Pukale is also the same. What to call Tengin Pukale? Actually, it's a preparation of coconut. Tengin Pukala. Anybody know what's the any Sanskrit name for Tengin Pukala?
विजिला को पता होगा। क्या बोलते हैं इसको?
नालिकेर प्रसूना मैडम, नालिकेर
Naligara
प्रसूना।
Prasan. Yes, yes. Yes, ma'am. Thank you.
मैम रिपीट करिएगा, नारिकेल
प्रसूना और पुष्पा, नालिकेर पुष्पा,
Naligara
नालिकेर
Pushpa.
प्रसूना, पुष्पा।
फ्लावर।
Okay.
हाँ,
That ma'am small thing which is inside the tender coconut.
Not, ma'am. No, it's not inside the tender coconut.
inflorescence,
Inflorescence, ma'am. From which
The
the
fluorescence.
coconut is developing, no, ma'am.
Okay,
That
inflorescence.
inflorescence, which is called as
Before fruiting.
yes,
Okay.
ma'am. Before
before
growth.
fruiting, before.
That is called as in the tender state. It is taken for preparing the medicine.
कामनी मैम, अभी मैडम जो एक स्प्रे की बात कर रही थी, तो एक सिकेट्रिस करके एक स्प्रे आया है, उसमें उन्होंने मधुइष्टि वगैरह, मंजिष्ठा, ये सब है।
हाँ
तो
हाँ
कुछ
हाँ हाँ
हाँ मैम, उसका बहुत अच्छा रिजल्ट है। और
हाँ।
साथ में एक ऑइंटमेंट करके आई है ग्रीन्स की, ग्रैब करके। तो
अच्छा।
ये मैम मतलब ये तो पोस्ट डिलीवरी तो यूज होता ही है, क्योंकि वहां पर एपिजियोटमी का वुंड है या ड्रेसिंग्स वगैरह में। लेकिन और भी जैसे जो वुंड्स हैं उसमें बहुत अच्छा इसका रोल है। तो स्प्रे वाला तो इसलिए क्योंकि नो टच टेक्निक से जैसे काढ़े से वो कर लिया अपना, सिकाई धूपन वगैरह किया, बाद में एक स्प्रे कर लिया, तो उसका बड़ा अच्छा है।
हाँ
मैम
हाँ हाँ।
और कोई मैम जैसे हम लोग बना सकते हैं घर में स्प्रे, और उसको हम स्प्रे वाली बॉटल्स में करके रख लें और उसको डाल सकते
हाँ,
हैं
कर
उन्हीं
सकते हैं
कंटेंट
ना,
पे, जो व्रण
जो भी
रोपक हैं जितने भी औषधियां।
जो भी आप कंडुग्न औषधियां हैं, वरण रोपण औषधियां हैं, उनका बना
जी
सकते हैं ना। बना
जी। और
सकते हैं।
और मैम ये एक सुतिका कुछ, ये जो सूक्ष्म त्रिफला एक जो बनता है मैम, महाराष्ट्र वाले ज्यादा अच्छे से जानते हैं सूक्ष्म त्रिफला, ये हम लोगों ने बहुत यूज किया। और पोस्ट
हाँ, एज
डिलीवरी भी
एंटीबायोटिक।
इट्स
हाँ
एक्ट्स एज एन एंटीबायोटिक, एंटी
हाँ
इन्फ्लेमेटरी ऑल्सो
हाँ
मैम।
हाँ 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 हाँ
और ये
हाँ।
15 डेज तक लगातार, ये 21 डेज तक लगातार देके देके मैम बहुत ही अच्छा रोल है इसका, ये डिलीवरी के बाद भी, और इवन इन पेल्विक इन्फ्लेमेटरी डिजीज मैम।
वो प्रिवेंटिव एस्पेक्ट में आप दे सकते हो कि अगर
नहीं मैम, पोस्ट
उसको
इवन आफ्टर द
हाँ
डिलीवरी,
हाँ
आफ्टर द
हाँ,
डिलीवरी ऑल्सो मैम।
आफ्टर डिलीवरी ही बोल रही हूँ कि आफ्टर
जी
डिलीवरी प्रिवेंटिव एस्पेक्ट से भी दे सकते हैं कि कहीं
जी जी
खून
जी,
इन्फेक्शन ना हो
कोई
किसी प्रकार।
सेकेंडरी इन्फेक्शन ना लगे। जी मैम।
हाँ, उसके लिए, हाँ उसके लिए यूज कर सकते हैं।
जी मैम, थैंक यू मैम। मैम पूरा सुन नहीं पाए क्योंकि कुछ अचानक से कुछ लोग आ गए थे, बट वो मुझे आप लिंक भेजेंगी तो हम लोगों को अच्छा रहेगा मैम।
हाँ
बहुत ही
बिल्कुल बिल्कुल।
इंटरेस्टिंग था, स्पेशली ये
हाँ
जब दूसरे रीजन से आती हैं चीजें, तो और भी जो कुछ ये प्रिपरेशंस बताते हैं वो
हाँ
अच्छा
हाँ।
लगता है सुन के। जी मैम,
जी जी
थैंक यू।
बिल्कुल
थैंक यू
बिल्कुल।
मैम।
फैमिली जी, मैं ऐड कर दूं थोड़ा सा?
जी जी बिल्कुल बिल्कुल सर।
जी मैडम। सभी को नमस्कार और दिव्या मैम को बहुत बहुत बधाई, जिन्होंने अच्छी तरह से अपने काम को प्रेजेंट किया। बहुत सारी चीजें बताई मैम ने, अपने केरला की भी बताई। तो अभी डिस्कस हो रहा था कि मैम ने क्या क्या बताया। तो आचार्य काश्यप बड़ी जबरदस्त बात कहते हैं। आचार्य काश्यप कहते हैं कि ये जो सूताचर्या है, सूतिकाचर्या है, वो सभी के लिए एक नहीं होके कुल सात्म्य बुद्धियन यस्मिन यस्मिन यथा यथा औचित्यात् कुल सात्म्य तथैवानुवर्तते। तो कुल सात्म्य के अनुसार जिस चीज की जो जो कुल सात्म्य है उसके अनुसार उसके लिए सूतिकाचर्या के लिए कहा है। इसके बाद आते हैं आगे और जबरदस्त बात करते हैं। अतई अतो नैकांतकत्वाच सूतिकोपक्रमस्य च देशम च जाति सात्म्यम च प्रधार्यम प्रयोजित। देश के अनुसार सूतिका की परिचर्या में चेंज हो जाएगा, जाति के अनुसार भी चेंज होगा, सात्म्य के अनुसार भी चेंज हो जाएगा। तो इस तरह से सूतिका परिचर्या का जो वर्णन आचार्य ने किया है वो अलग अलग किया है। एक बड़ा इंटरेस्टिंग बात चल रही थी अभी, हमने बात की कि अपने जो व्रण होता है उसके लिए क्या चिकित्सा करें। तो व्रण अकेली योनि छत के लिए चिकित्सा बताई गई है, वो एपिजियोटोमी का व्रण हो चाहे अपने LSTS की बात का व्रण हो। तो व्रण छत के योनि छत की चिकित्सा के अंदर जो बताई है वही चिकित्सा। वैसे तो आचार्य काश्यप तो बहुत जबरदस्त बात करता है। आचार्य काश्यप कहते हैं सूतिकाया विशेषेण रक्षोघ्नान एतानि, यानी रक्षोघ्न कौन है? रक्षोघ्न जो व्रणी अवस्था में व्रणी को जो प्रक्रिया की जाती है वही की जाती है। अब क्यों व्रणी की जाती है? तो व्रणी की इसलिए की जाती है क्योंकि जो यूट्रस है, यूट्रस के अंदर जो एंड्रोमीट्रियम है, एंड्रोमीट्रियम वहां से अपने निकली हुई होती है प्लेसेंटा के साथ में। उसके बाद में वहां पर जो प्लेसेंटा के बाद में एंडोमेट्रियम का जो रिपेयरिंग हो रही होती है 7 से लेकर के 10 दिन तक लगते हैं। तो उस समय जो एंडोमेट्रियम का पूरा एरिया उसमें इन्फेक्शन के चांसेस ज्यादा रहते हैं। दूसरे अपने योनि है या वेजानल अपने टीयर्स वगैरह हैं, वेजानल अपने क्या नाम है, उसमें डिल्यूशन होता है एंडोथेलियल लेयर का, उसमें भी इन्फेक्शन के चांस बनते हैं। इसलिए उन्होंने बहुत जबरदस्त बात की है। आचार्य काश्यप कहते हैं कि उसको व्रणी के रूप में प्रयोग किया जाए। अभी मैम डॉक्टर साहब ने बात की कि उसके अंदर व्रण धूपन, जो धूपन व्रण के अंदर धूपन किया जाता है, उन्हीं द्रव्यों के द्वारा योनि के धूपन के लिए कहा गया। मगर जब योनि के व्रण की चिकित्सा की बात आती है तो वहां पर कभी भी वेट ड्रेसिंग के लिए मना किया गया। वेट ड्रेसिंग कहीं भी होती है वहां पर वेट, अपने एपिजियोटोमी का भी पेशेंट आता है या अपने LSTS का पेशेंट आता है तो वहां पर ड्रेसिंग कभी बीटाडिन से नहीं की जाती। बीटाडिन से कब की जाती है? जब शुरुआत होती है, उसके बाद में उसको ड्राई ड्रेसिंग की जाती है। अभी जो स्प्रे की बात कर रहे हैं, तो स्प्रे जितने भी स्प्रे हम लोग यूज करें उनको अपने जो ईथर अथवा तो अल्कोहल सॉल्युबल होंगे, जो ईथर की वजह से होते हैं, ईथर में जाते स्प्रे आते हैं, जो ईथर सॉल्युबल जो अपने इंग्रेडिएंट्स वाले मेडिसिन हैं, चाहे व्रणरोपक हो चाहे व्रणशोधक हो, उनका प्रयोग किया जा सकता है, अवचूर्णन किया जा सकता है। परंतु वेट करने की वजह से उसके अंदर स्निग्धता की वजह से क्लेद हो जाएगा उसके अंदर, व्रण के अंदर उतना ही चाहते हैं उसके अंदर अपने को हेलिंग में प्रोसेस में दिक्कत आएगी। एक जबरदस्त में हमने बात की थी कि ये 3 महीने 1.5 महीने 4 महीने 6 महीने पुनरावर्तक दर्शन तक क्यों कहा गया है? बड़ा साइंटिफिक चीजें ऐसे थे। हर आचार्य ने अपनी अपनी बात कही है। तो इतनी साइंटिफिक बात, जैसे मान लीजिए 1.5 महीने में क्यों? तो यूट्राइन इन्वोल्यूशन जो है वो 1.5 महीने में हो जाता है। मगर जहाँ जो धातु उन्होंने बताया, धातुओं के क्षय की वजह से जो अपने सूतिका है उसमें बात वृद्धि होती है, उसके अंदर होने वाले रोग मांस बल क्षय की वजह से दुष्चिकित्स होते हैं। तो मांस क्षय नहीं, अकेला नहीं, बल्कि धातु क्षय की वजह से उसके अंदर दुष्चिकित्स होते हैं। तो धातु कौन कौन सी कि अपने जानते हैं कि गर्भावस्था के अंदर बहुत सारे चेंजेस आते हैं, यूट्रस में, फैलोपियन ट्यूब में, वेजाना में, हॉर्मोन्स के अंदर। और बच्चे के अंदर कहाँ से आ रहा है? उसके अंदर वो धातुएं कहाँ से जा रही हैं? माँ को अगर न्यूट्रिशन मिल रहा है तो ठीक है, नहीं माँ तो उसको पोषण देगी ही देगी। जब माँ के अंदर से धातु पोषण नहीं होगा तो उसके अंदर धातुओं की जो पोषण अपने रिवर्ट होता है, धातुओं की अपने तब कब आएगा? धातुषु प्रतिपूर्णेषु, जब अपने जब शुरुआत होती है कन्याओं में कब नहीं आता, मैसेज क्यों नहीं आता? तो उसमें कहा धातुषु प्रतिपूर्णेषु, जब धातुओं की पूर्ति हो जाएगी तब आएगा। तो ऐसे ही सूतिका काल के अंदर भी धातुओं की पूर्ति हो जाएगी उसके बाद आएगा। इसलिए जो धातु पूर्ति हो गई है तो मेंसेस हो गया, वहां तक बता दिया। फिर व्रणीय अवस्था है, उसको उन्होंने बता दिया 1 महीने का। फिर 4 महीने का क्यों बताया, तो शरीर के अंदर जो अपने जितने टिश्यूज हैं, जिस टिश्यू में जितने दिनों के बाद में चेंजेज आते हैं उतने दिनों के बाद में रिवर्ट होता है। अब आपने मान लीजिए जो जो लिगामेंट्स हैं, जो अपने लिगामेंट्स पेल्विक लिगामेंट्स रिलैक्स होते हैं अपने उसकी वजह से, तो उसका परिणाम क्या होता है, उसके लिगामेंट्स के अंदर इतना रिवर्ट नहीं होता कि 3 महीने के अंदर अपने लिगामेंट्स बस हो जाएंगे। तो पूरी तरह से लिगामेंट्स को अपने रिस्ट्रेन करने के अंदर उसमें 1 साल तक भी लग जाता है। तो जो धातु में जितनी देर शिथिल धातु है उतनी जल्दी हो जाएगा, और जितनी टाइट धातु है अस्थियों के अंदर जैसे बोन के अंदर कमी आएगी उसमें टाइम लगेगा। तो कई जगह पे आचार्यों ने 3 साल तक भी कह दिया है। पूरी तरह से यूट्रस के अंदर पूरे शरीर से अंदर जितने भी न्यूट्रिएंट्स होते हैं, जितने भी चेंजेस आते हैं, वो जैसे मतलब अपने कहते हैं LSCS वाला पेशेंट, LSCS वाले पेशेंट को अपने क्या कहते हैं, कम से कम 1 साल तक अपने को प्रेग्नेंट नहीं होना है। क्योंकि उसका जो यूट्रस की अंदर जो वॉल है निश्चित ही मस्कुलर कोट है वो ठीक है, उसके बाद में सिरस कोट है उसको भरने में टाइम लगता है। तो इस तरह से अपने टाइम 3 चीजों से डिपेंड करता है, पेशेंट की क्या स्थिति है, और उसके अंदर पेशेंट के न्यूट्रिएंट्स कितने हैं, पेशेंट के अंदर डिलीवरी किस टाइप की हुई है। तो ये सारी चीजें सर्कमस्टेंसेस के ऊपर डिपेंड करती हैं। इसलिए आचार्यों ने 1.5 महीने से 1 महीने से लेकर सप्ताह का अलग बताया, 1 महीने का अलग बताया, 1.5 महीने का अलग बताया, 4.5 महीने का अलग बताया, 6 महीने का अलग बताया, और पुनरावर्तन दर्शन का बताया, और किसी जगह 1 साल की बताया। अब आती है बात दूसरी, एक बड़ी साइंटिफिक बात उन्होंने डॉक्टर आचार्य ने कही है, अभी मैम बता रही थी सैंधव के साथ में उन्होंने वो दिया है। तो सैंधव के साथ में वो कहते हैं, सैंधव के साथ में 3 दिन तक वो जितनी भी मेडिसिन दी है, देखिए पहले क्या होता है, जैसे डिलीवरी होती है तो प्रकृति का नियम है, उसको ब्लीडिंग को रोकने के लिए प्लेटलेट्स बढ़े हुए रहते हैं और अपने फाइब्रिन बढ़ी हुई होती है, और प्लेटलेट्स और फाइब्रिन बढ़े होने के परिणाम स्वरूप ही अपने डीप एंड थ्रोम्बोसिस होता है, डीप एंड थ्रोम्बोसिस की चांसेस बढ़ जाते हैं। तो उसके लिए आचार्य ने क्या किया, आचार्य ने किया कि जो अपने डीप एंड थ्रोम्बोसिस ब्लड को पतला कर, अगर ब्लड को पतला करते हैं तो ब्लीडिंग ज्यादा हो जाएगी। तो ब्लड को पतला करने के लिए, ब्लड को सर्ग गुण बढ़ाने के लिए, ब्लड की द्रवता बढ़ाने के लिए उन्होंने उष्ण तीक्ष्ण औषधियों का प्रयोग किया, जिसके अपने पंचकोल है, पंचकोल के द्वारा, और अधिकतर शुंठी का प्रयोग किया। और दूसरे तरफ क्या किया, दूसरे तरफ का यूट्रस के कॉन्ट्रैक्शन इन्वॉल्यूशन के लिए मेडिसिन दी। तो इन्वॉल्यूशन के मेडिसिन, जो मेडिसिन इन्वॉल्यूट करती हैं यूट्रस को, प्लस ब्लड को पतला करती हैं, ब्लड को अपने थिन करती हैं, जिसकी वजह से अपने वो नहीं हो, थ्रोम्बोसिस नहीं हो, उन मेडिसिन का प्रयोग किया। उसमें अपने पंचकोल वगैरह है, जितने भी पंचकोल वगैरह है उनका प्रयोग किया है। और इसमें एक चीज उन्होंने जबरदस्त कही है आचार्य ने, कि जब तक 3 दिन तक हम लोग दे रहे हैं, क्या दे रहे हैं, अपने कुलत यूज दे रहे हैं, ससनी लवणाम, और उसमें बता दिया है कि अलवणाम, उसमें लवण नहीं देना है, नमक रहित देना है। तो जहाँ पे भी शरीर में कहीं भी इंजरी हुई होती है, जहाँ पे भी पेशेंट के अंदर इंजर्ड पेशेंट है, उसको लवण इसलिए बंद कर देते हैं, सोडियम वाटर कंटेंट्स को रोकता है, और वाटर कंटेंट जब रुकते हैं तो इन्फ्लेमेशन बढ़ता है, और इन्फ्लेमेशन बढ़ने का चांसेस, इन्फेक्शन के चांसेस बढ़ जाते हैं। तो जहाँ सोडियम नहीं देना है वहां पर 3 दिन तक उन्होंने बताया, 3 दिन तक, जब तक अपने 3 रात्रि है वहां तक सोडियम देना है। उसके बाद में लवण के साथ में स्नेह लवण अम्ल रसम परम, उसके बाद में जब कुलत दे रहे हैं तो स्नेह के साथ में लवण भी देना शुरू कर दिया। तो आचार्य इतनी जबरदस्त बात करके गया है। अब बात आती है यहाँ पर कि किस तरह से, तो मैम ने बताया इतनी सारी मेडिसिन बताई हुई है, उन मेडिसिन को पेशेंट की स्थिति के आधार पे कहाँ 10 मूल देना है, कहाँ रासनादिक्वात देना है, कहाँ एरंडमूलादिक्वात देना है, कहाँ अपने पंचकोल देना है, अगर ब्लीडिंग हो रही है तो क्या करना है, ये पेशेंट के ऊपर डिपेंड करता है। और कुल सात्विक के अनुसार जो कश्मीर के ये अलग है और अपने केरला की चीज अलग है, तो यहाँ जो पैदा होता है उसकी औषधि वहाँ पे प्रयोग करते हैं। उसके बाद में सप्ताह के बाद में अपने जीरक का प्रयोग करते हैं, शुंठी का प्रयोग करते हैं, और कई चीजें अपने उत्तरी भारत में देते हैं, गुड़ के द्वारा बना के हलवा वगैरह देते हैं, जिससे मतलब स्तन का वृद्धि हो। जब यूट्रस इन्वॉल्यूशन हो गया, 15 दिन हो गए, उसके बाद में जो कॉम्प्लिकेशन नहीं हुई उसकी, तो उसके बाद में उसका प्रयोग करते हैं। तो इस तरह से इतना साइंटिफिक बात कही है, उनको धीरे से अपने उसको अपनाने की बात है। सभी औषधि एक को नहीं दे सकते, और सभी पेशेंट के लिए एक औषधि नहीं हो सकती, इसलिए कंडीशन के आधार पर प्रयोजन में बताया गया है। बहुत ही अच्छा लगा, मैम ने बहुत बताया। मॉडर्न साइंस में भी वो की वही कही गई है, मॉडर्न साइंस में वो कही गई जो हमने कहा है, हमने जो कहा है वो कोई उन्होंने कहा है तो मगर उन्होंने अलग अलग कर दिया है कि यूट्रस का कितने दिन में इवोल्यूशन होगा, फैलोपियन ट्यूब में क्या चेंजेस आएंगे, ओवरी में क्या चेंजेस आएंगे, हार्मोन्स में क्या चेंजेस आएंगे, बोन्स में क्या चेंजेस आएंगे, कितने दिनों में आएंगे, कार्डियक आउटपुट में कितना आएगा, ब्लड में कितना आएगा, वो डेट बाई टाइम टू टाइम बता दिया है। हमने अपने इस तरह से अलग अलग बताया। तो मेरे ख्याल से बहुत ही अच्छा प्रेजेंटेशन था, और इसको अपने फॉलो करें और विभिन्न प्रकार के पेशेंट टू पेशेंट डाइवर्ट करते हुए। हाँ, आचार्य चरक ने एक और चीज कह दी, मैं भूल गया। यूट्रस को उधर पद्धति से द्वारा एब्डोमेन को बांधना, मसाज करना, पहले मसाज करना। मसाज का मतलब है इन्वोल्यूशन, यूट्रस को इन्वोल्यूट करना है। इन्वोल्यूट करके जैसे अपने पीपीएच के अंदर भी मसाज करते हैं हम, एक्सटर्नल मसाज और इंटरनल मसाज, दो तरह की करते हैं। तो यूट्रस को इन्वोल्यूट करने के लिए मसाज करनी है, उसके बाद में उसके ऊपर उधर उधर पे पटबंधन करना है। तीसरी चीज उन्होंने एक और कही, चर्मानंद आसंदी। एक अपने एक टब लेना है, चर्मानंद आसंदी टब लेना है, उसमें स्नेह भरना है, उसमें उसको बैठाना है महिला को, जिससे अंदर अगर योनि क्षत वगैरह हुआ होगा तो उसके अंदर योनिम प्रसीदति, उससे योनि प्रसीदित होती है, पूर्व अवस्था में आती है। इसलिए उन्होंने तेल के अंदर बैठने के लिए सिट बात भी कहा गया है। हम आजकल कोष्ठ और पानी के मैम ने बात बताई, किस तरह से स्नान करना है, कौन से दिन से स्नान करना है, तो उष्णोदक स्नान उन्होंने बताया आचार्य ने। तो इसलिए इतना साइंटिफिक चीजें बताई हैं। बहुत बहुत धन्यवाद, थैंक यू वेरी मच, बहुत ही
तो
मजा आता
रामवी सर, एक क्वेश्चन
है।
आपसे है। अभी जैसे आपने बताया ना स्नेह में, तो ठीक ही है वो, लेकिन जो पुराने जैसे हम लोग दादी वगैरह से सुनते थे कि हम लोग बोलते थे उनसे कि कितना कैसे हो जाता था ये, होम डिलीवरी आराम से कराते थे। इवन जो पढ़े हुए डॉक्टर्स होते थे वो भी घर में डिलीवर कराते थे। तो सर ये जो कच्ची शराब बोलते थे कि उसके टब में बिठाते थे पेशेंट को, स्क्वाट पोजीशन में डिलीवर करा के, फिर उसके बाद ये सब पूरा निकाल के अपना अंदर से कंसेप्टस वगैरह, तो ये प्लेसेंटा, उसके बाद फिर कच्ची शराब में बिठाते थे। तो क्या वो ठीक होता था या क्या था कि वो
जी बिल्कुल,
जी
बहुत
उसके
अच्छा
ऊपर थोड़ा
प्रश्न।
प्रकाश डालिए।
आपका बहुत अच्छा प्रश्न है। कच्ची शराब जो है, मैंने अभी जस्ट बात की, ईथर एल्कोहल। अपने कहीं
जी
चोट लग जाती है, क्या कराते हैं, स्पिरिट, कुछ कुछ मत करो, स्पिरिट का खोआ बांध दो,
जी,
कहीं चोट
प्रोटीन
लगती
को
है ना।
प्रेसिपिटेट करने के लिए।
हाँ, तो एल्कोहल है, कच्ची शराब क्या एल्कोहल है, वो भी लाइक स्पिरिट है, स्पिरिट भी एल्कोहल है, एथाइल एल्कोहल, मिथाइल एल्कोहल। तो कच्ची शराब को डिलीवरी के बाद, हाँ डिलीवरी के बाद में उसमें टब के
जी
अंदर बात करते थे, तो उसमें कच्ची शराब के अंदर बिठाते। तो उसकी दो चीजें हैं, उसकी फायदा, एक तो वो एंटीसेप्टिक के काम में रूप में काम करती है, एक वो भंग संकोचक का भी काम करती है। आप अपने भाव प्रकाश पढ़ेंगे तो उसमें लिखा हुआ है, अगर अपने यौन संकोचक की औषधियों का प्रयोग करना है तो उसमें अपने उसका थोड़ा का क्लोथ लेके उसके अंदर योनि के अंदर रखें, तो उससे वो संकुचित हो जाती है। हालांकि संकुचित का मतलब ये कॉन्ट्रेक्शन, जैसे स्प्रिट डालते हैं तो थोड़ा सा अपने रिस्ट्रिक्ट करके कॉन्ट्रेक्शन करती है, तो इस तरह एंटीसेप्टिक के रूप में उसका प्रयोग करते हैं। तो एक तरह से वो एल्कोहल है, इसलिए उसका प्रयोग करते थे आफ्टर डिलीवरी।
जी सर, वो जो क्षत वगैरह हो जाते होंगे जैसे उनको वहाँ के उस एरिया को ये प्रेसिपिटेट करके प्रोटीन्स को, उसको वो हीलिंग में भी हेल्प करते होंगे साथ साथ।
एक्चुअली क्या है
जी
कि
जी
भले क्षत नहीं हुआ है, मगर एंडोथीलियल लेयर इतनी सॉफ्ट है तो वहाँ निश्चित ही कुछ न कुछ डिन्यूशन होता है, कुछ न कुछ वहां से निकलता है, एरप्शंस बनते हैं, तो
जी
वहाँ पे
जी,
रिजल्ट।
थैंक यू सर।
जी, थैंक यू।
Over to Agnihotri sir for conclusion, sir.
थैंक यू
आपका है
मैम,
क्या?
थैंक यू।
जी
हाँ बिल्कुल है। एक तो क्वेश्चन छोटा सा रह गया था कि पोस्टमार्टम अगर बच्चे कोई गैस्ट्रिक डिस्टर्बेंस है तो कोई चीज देके, वो क्वेश्चन नंबर 1 था। मेघा ने पूछा है शायद, during the PP medications, any stomach disturbance to the baby, what should be given? ये मेघा ने पूछा था। तो
ये सर ऐसा लगता है कि क्वेश्चन ये है कि जो पीपी के समय पोस्टमार्टम जो मेडिकेशंस दिए जाते हैं और वो स्तन के थ्रू शायद वो बेबी के पास जाते हैं, तो
तो
बच्चे
बेबी
के
को
पेट में कोई
डिस्टर्बेंस,
डिस्टर्बेंस होते हैं, तो
राइट
उसके
राइट,
विषय पे
वही,
शायद प्रकाश डालना है सर।
हाँ वही मैं भी समझ पाया था। एनीवे डॉक्टर दिव्या अगर हैं तो कुछ बताएंगे, नहीं तो कोई बात नहीं, हम कंक्लूड करते हैं क्योंकि अगली वेबिनार का टाइम हो रहा है।
दिस इज
बहुत अच्छा
सब्जेक्ट ऑफ
था
द पीडियाट्रिशियन,
जी।
दिस इज द सब्जेक्ट ऑफ द पीडियाट्रिशियन, नॉट ए गायनेकोलॉजिस्ट और
ओके ओके
ऑब्स्टेट्रिशियन।
ओके, नो वेल, हम अभी इसको कंप्लीट करना चाहेंगे,
सर
तो क्योंकि
एक
नई
एक
वेबिनार का भी टाइम हो रहा है। यस मुझे, आप कुछ कह रहे हैं?
हाँ,
सबसे बड़ी
एक
चीज जो
एक
है
बस
आज हमारा
क्वेरी था
प्रेजेंटेशन।
मेरा, किसी को कोई अनुभूति है इसके बारे में तो, कि अभी सुतिका बेबी एवरीवन इज फाइन तो ठीक है, लेकिन कभी ऐसा होता है कि बेबी की डेथ हो जाती है, तो हमें स्तन्य का
हम्म,
सप्रेशन करने के लिए किसी ने आयुर्वेदिक ड्रग्स का
हम्म।
उपयोग का अनुभव कोई शेयर कर